These foods may reduce heart disease by 50%. Is that really possible? Can changing what you eat actually cut your risk of a heart attack or stroke in half? Research from the last several years suggests the answer is yes. But here is the catch. It is not one single superfood. It is a pattern. A combination of everyday foods working together. Today, I will show you exactly which foods have the strongest evidence behind them, how they protect your heart, and how you can start eating this way starting with your next meal. Welcome back to HEH. I'm Dr. Vivian Hart. Let me start with a number that might surprise you. Nearly half of all deaths from heart disease are linked to one thing: poor diet. According to a 2016 study, dietary factors contributed to nearly half of all cardiovascular deaths annually. That is not genetics. That is not bad luck. That is what you put on your plate. The good news is that the same research shows that improving your diet is one of the most powerful things you can do to protect your heart. But what does a heart-protective diet actually look like? The most extensively studied heart-healthy diet in the world is the Mediterranean diet. Researchers have followed thousands of people for decades to understand how this traditional way of eating affects the heart. A 2024 Umbrella Review, which is a study of studies, analyzed 18 meta-analyses of randomized controlled trials. Compared to usual care, the Mediterranean diet was associated with reduced cardiovascular disease mortality. The review found that the Mediterranean diet can reduce fatal cardiovascular disease outcome risk by 10 to 67% and non-fatal cardiovascular disease outcome risk by 21 to 70%. That is a wide range, but even at the lower end, the benefit is substantial. So what is the Mediterranean diet exactly? It is not a strict meal plan. It is a pattern. High intake of vegetables, fruits, whole grains, legumes, nuts, and seeds. Extra virgin olive oil as the primary fat source. Moderate intake of fish and seafood. Low to moderate intake of dairy, eggs, and poultry. And very low intake of red meat, processed meats, and sweets. This pattern delivers a combination of fiber, healthy fats, antioxidants, and anti-inflammatory compounds that work together to protect your arteries. Now, let me introduce you to a less familiar but equally powerful approach. It is called the portfolio diet. It was developed by researchers at the University of Toronto over 20 years ago. But it is only recently gaining attention because the evidence has become so strong. A 2025 study published in BMC Medicine followed nearly 15,000 adults over 22 years. Those who most closely followed the portfolio diet had a 16% lower risk of dying from cardiovascular disease and a 14% lower risk of early death from any cause. What makes the portfolio diet unique is that it combines 4 specific food categories that each lower cholesterol in different ways, creating a synergistic effect. The effect is so powerful that initial studies showed the portfolio diet lowered LDL cholesterol by almost 35% in just 4 weeks, comparable to the effect of early statin medications. What are the 4 pillars of the portfolio diet? First, nuts and seeds. Second, plant protein from sources like soy, tofu, and legumes. Third, viscous or sticky fiber from foods like oats, barley, eggplant, okra, apples, citrus fruits, and berries. And fourth, plant sterols, which are naturally found in nuts, seeds, legumes, and vegetable oils. When you eat these 4 categories together, their cholesterol-lowering effects add up. Let me go deeper into each of these food categories because the science is remarkable. First, nuts and seeds. Walnuts are particularly powerful because they are the only nut that provides a significant amount of alpha-linolenic acid, a plant-based omega-3 fatty acid. A 2025 study published in the Journal of the American College of Cardiology revisited data from the Walnuts and Healthy Aging trial. 700 older adults were followed for 2 years. Those who consumed walnuts daily significantly reduced 6 out of 10 inflammatory biomarkers. Chronic inflammation is a key driver of heart disease. Spanish research found that eating walnuts 3 times per week could reduce cardiovascular disease risk by 55%. Walnuts are not alone. Almonds have been shown to lower LDL cholesterol. Pistachios improve blood pressure. A 2026 guidance from the American Heart Association strongly emphasizes that higher nut intake is linked to lower cardiovascular disease and coronary heart disease risk. Second, legumes. This category includes beans, lentils, chickpeas, and peas. Legumes are one of the most affordable and accessible plant foods, yet they remain significantly underutilized. A 2025 review in the American Journal of Lifestyle Medicine explains that legumes have high soluble fiber content, which helps reduce LDL cholesterol. They are naturally low in sodium and high in potassium, which supports blood pressure regulation. They also have a low glycemic index, which promotes steady glucose absorption and improves insulin sensitivity. A 2025 randomized controlled trial found that eating just 1 cup of black beans or chickpeas daily for 12 weeks led to meaningful improvements in cholesterol and inflammation. Chickpeas lowered total cholesterol from approximately 200 to 186 milligrams per deciliter, largely due to a decrease in LDL cholesterol. Black beans significantly reduced IL-6, a pro-inflammatory cytokine. The soluble fiber in beans binds to cholesterol in the digestive tract, helping remove it from the body. Another study found that eating 2/3 of a cup of beans daily can lower LDL cholesterol. Even oatmeal, which contains the soluble fiber beta-glucan, has been shown to lower LDL cholesterol by 5 to 10% within 6 weeks when consumed as part of a high-fiber diet. Third, berries and other colorful fruits. Berries are rich in polyphenols, which are natural compounds with powerful antioxidant and anti-inflammatory effects. A 2024 review published in the journal Nutrients summarized current research on cherries and berries. Studies suggest that regular consumption of these fruits may reduce inflammation and oxidative stress, leading to lower blood pressure, improved lipid profiles, and enhanced endothelial function, which is how well your blood vessels can relax and expand. Blueberries have been shown to improve vascular function and reduce blood pressure in people with metabolic syndrome. The flavonoids in berries inhibit LDL oxidation, which is a key step in the formation of artery-clogging plaques. They also improve platelet function, reducing the risk of dangerous blood clots. Fourth, leafy green vegetables. Spinach, kale, arugula, Swiss chard, and other greens are rich in inorganic nitrate. Your body converts this nitrate into nitric oxide, a molecule that helps blood vessels relax and widen. A 2023 clinical trial specifically evaluated the effect of leafy green vegetables on blood pressure in people with elevated blood pressure. The study provided participants with leafy greens containing 300 milligrams of nitrate daily for 5 weeks. The results showed that leafy greens helped improve cardiovascular function through the nitrate-nitrite-nitric oxide pathway. Other research has confirmed that dietary nitrate from greens can reduce blood pressure, inhibit platelet aggregation, preserve endothelial function, and enhance exercise performance. A study from the Karolinska Institute found that nitrate-rich vegetables like arugula and other leafy greens can enhance the heart's ability to protect itself during heart attack or reduced blood flow. Fifth, whole grains. Oats, barley, quinoa, brown rice, and whole wheat are rich in fiber, B vitamins, and minerals. But the real star is beta-glucan, a type of soluble fiber found in oats and barley. Beta-glucan forms a gel-like substance in your digestive tract, which traps cholesterol and prevents it from being absorbed into your bloodstream. A 2026 Harvard Health article notes that one of the best ways to boost your fiber intake is to eat more whole grain foods such as 100% whole wheat bread, oatmeal, brown rice, and quinoa. Legumes are also naturally low in sodium and often high in potassium, which helps keep blood pressure under control. The American Heart Association's 2026 dietary guidance strongly encourages swapping red meat for plant-rich proteins to support heart health. They also emphasize high-fiber, low-cholesterol diets rich in fruits, vegetables, whole grains, and minimally processed foods. Sixth, healthy oils. Extra virgin olive oil is a cornerstone of the Mediterranean diet and the portfolio diet. It is rich in monounsaturated fats and polyphenols. A 2018 study found that among older adults at high cardiovascular risk, those who consumed the most olive oil had a significantly lower risk of cardiovascular events. Other heart-healthy oils include avocado oil and oils from nuts and seeds. The key is to replace saturated fats like butter and coconut oil with these unsaturated fats. The 2026 American Heart Association guidance now broadly recommends choosing foods rich in unsaturated fats over those high in saturated fats, rather than just focusing on cooking oils. Now let me tell you what the research says about the magnitude of risk reduction. A 2024 umbrella review of systematic reviews compared vegetarian dietary patterns to non-vegetarian diets. Vegetarian patterns were associated with a 15% reduction in CVD incidence and an 8% reduction in CVD mortality. Vegan patterns were associated with even greater reductions in blood pressure, LDL cholesterol, and body mass index. Another 2024 review found that higher adherence to a predominantly plant-based heart-protective diet rich in non-starchy vegetables, fruits, whole grains, fish, eggs, and low-fat dairy products is associated with reduced cardiovascular disease incidence and mortality. The evidence from the Million Veteran Program, a large study of over 150,000 U.S. veterans, found that a healthful plant-based diet enriched with healthier plant foods was associated with a substantially lower cardiovascular disease risk. A systematic review of 28 meta-analyses confirmed that higher intake of fruits, vegetables, nuts, seeds, and whole grains reduces cardiovascular disease risk, while processed meats and sugary drinks increase it. So how do you actually put this into practice? Let me give you a simple framework. I call it the Heart Protection Plate. Step 1. Fill half your plate with non-starchy vegetables at lunch and dinner. Leafy greens, broccoli, bell peppers, cauliflower, zucchini, tomatoes, eggplant. The more colors, the better. Each color represents different antioxidants and polyphenols. Aim for at least 5 servings of vegetables per day. Step 2. Reserve 1/4 of your plate for plant-based protein and legumes. Chickpeas, black beans, lentils, tofu, tempeh, edamame. A 2025 study found that swapping just 1 serving of meat for legumes per day can reduce your risk of heart disease. Step 3. Reserve the remaining 1/4 of your plate for whole grains. Oatmeal, quinoa, brown rice, barley, farro, 100% whole grain bread. If you are eating oats or barley, you are getting beta-glucan, the cholesterol-lowering fiber. Step 4. Add a small handful of nuts or seeds to your day. A 2025 study found that a 1-ounce serving of walnuts, about a handful, consumed daily reduced inflammatory markers. Almonds and pistachios are also excellent choices. Step 5. Use extra virgin olive oil as your primary cooking and dressing oil. Avoid butter, coconut oil, and palm oil. Drizzle olive oil over vegetables before roasting. Use it in salad dressings. Replace butter on bread with olive oil for dipping. Step 6. Eat berries and other colorful fruits daily. Blueberries, strawberries, raspberries, blackberries. Aim for 1 to 2 servings per day. Add them to oatmeal, yogurt, smoothies, or eat them fresh. Now let me address the question you are probably asking. Do I have to be strictly vegetarian to get these benefits? No. The research shows that predominantly plant-based patterns, not exclusively plant-based, are associated with the lowest cardiovascular risk. The 2026 American Heart Association guidance recommends a diet centered on fruits, vegetables, whole grains, plant-based proteins, and unsaturated fats, while limiting sugar, sodium, and ultra-processed foods. You can include fish, eggs, and low-fat dairy. The key is to make plants the star of your plate and move meat to a supporting role. What about people who already have heart disease? The Mediterranean diet has been studied extensively in secondary prevention, meaning people who have already had a heart attack or stroke. The 2024 Umbrella Review found that the preventive effect of the Mediterranean diet was more significant in populations with established cardiovascular disease. Among people with existing heart disease, the diet reduced the risk of recurrent events by roughly 30 to 70%, depending on the outcome. This means it is never too late to benefit. Even if you have already been diagnosed with heart disease, changing what you eat can dramatically improve your prognosis. The portfolio diet has also been studied in people with high cholesterol. A 2025 study found that people with high LDL cholesterol experienced a 35% reduction in LDL after just 4 weeks on the portfolio diet. This effect was comparable to early statin medications. The authors noted that 50% compliance with the portfolio diet still produced clinically meaningful cholesterol improvement. You do not have to be perfect. Partial adherence still helps. Now, let me discuss how quickly you can expect to see changes. Research on the portfolio diet showed LDL cholesterol changes within 4 weeks. Research on beans showed cholesterol and inflammation changes within 12 weeks. Research on blood pressure from dietary nitrates showed changes within hours to days. The improvements start rapidly. However, the full cardiovascular protection likely accumulates over months and years. Every heart-healthy meal you eat reduces inflammation, improves your lipid profile, and lowers your blood pressure. These small daily wins add up to a dramatically lower risk of heart attack and stroke. What about people on medications? Dietary changes are not a replacement for prescribed medications like statins or blood pressure drugs. Do not stop taking your medication without talking to your doctor. But research shows that dietary changes can enhance the effectiveness of medications. In some cases, people who make dramatic dietary improvements may eventually need lower doses of medications. This is something you should only do under medical supervision. The portfolio diet study specifically noted that the diet can be used as an adjuvant therapy to cholesterol medications. Let me also address cost. One of the common misconceptions about heart-healthy eating is that it is expensive. But the 2026 American Heart Association guidance notes that a lot of heart-healthy foods are actually some of the most affordable and convenient, such as beans, lentils, oats, frozen vegetables, and canned fish. Dry beans cost pennies per serving. Frozen berries are just as nutritious as fresh and are often much cheaper. Oats are one of the most affordable breakfast options. You do not need expensive superfoods or supplements, you need basic, whole foods. Now let me address sustainability. A 2025 study on plant-based foods for chronic disease prevention found that plant-based dietary patterns not only reduce cardiovascular disease risk but also have a lower environmental impact compared to meat-heavy patterns. This is a win for your heart and for the planet. Let me summarize the key numbers so you remember them. The Mediterranean diet can reduce fatal cardiovascular disease risk by 10 to 67%. The portfolio diet can reduce LDL cholesterol by 35% in 4 weeks. Eating walnuts 3 times per week may reduce cardiovascular disease risk by 55%. Eating 1 cup of beans daily for 12 weeks meaningfully improves cholesterol and inflammation. Replacing saturated fats with polyunsaturated fats from nuts and seeds reduces heart disease risk. High soluble fiber intake of 5 to 10 grams per day can lower LDL cholesterol by 5 to 10% within 6 weeks. Vegetarian dietary patterns are associated with a 15% reduction in cardiovascular disease incidence. The portfolio diet over 22 years is associated with a 16% reduction in cardiovascular disease mortality and a 14% reduction in all-cause mortality. Remember, this is educational content. Always consult your healthcare provider before making significant changes to your health routine, especially if you have a known medical condition or take prescription medications. Do not stop your medications. Add heart-healthy foods alongside your treatment plan. If you found this video helpful, share it with someone who needs to hear it. Cardiovascular disease is the leading cause of death worldwide, but much of it is preventable. The foods on your plate today determine your heart health tomorrow. Subscribe to HE for more science-based health education. I post new videos every week breaking down complex health topics into simple, actionable steps. And leave a comment below. Which of these foods are you going to add to your plate this week? I read every single comment and I will do my best to answer your questions. I'm Dr. Vivian Hart. Protect your heart, and I will see you in the next video.